y'all. Welcome to another episode of It's Time with keandraward with me, your host, keandraward. Of course, I told you guys before, I'm excited about this new series. We're talking health and wellness. One, because it's a journey that I've been on the past 2 or 3 years with having high blood pressure, being overweight, just all kind of stuff that I didn't need to have. I was just being lazy, y'all. And I made myself sick by just not doing what I was supposed to do, right? And so I wanted to bring on experts throughout these next 4 weeks that are experts in the health and wellness field in different aspects. And of course, there is absolutely no way that I could do this without having an expert guest host, because I don't even know what questions to ask. I only know the personal ones to ask. She know the real deal. You know what I'm saying? So I'm excited to introduce our guest host for this, Miss Michelle Greenrose. Hey.
Hey. Good afternoon.
How are you? How's your day?
Thank you. Good. Doing well. How you doing, Keandra?
I'm here. I'm rested. I will say I have been working on getting the number amount of sleep. I've been getting my rest. So I'm excited about that.
Yes.
So before we get into today we definitely will be talking about weight loss, which is something that has been extremely important to me in my journey. I want to just talk about you. What do you have going on? Let our audience know who you are, what you do, why you do it, and how to find you.
Well, hey, everyone. Thank you, Keandra, for the opportunity. Excited to be here and help you through this series. So important that we address this. So shout out to you for just pausing and bringing the information to the people. But yeah, I'm Michelle Greenrose, the owner and founder of The Color Wellness Media, because we have expanded from a magazine to now podcasting, video channel, and live events. So, if you haven't had a chance to, please follow us we're on Facebook, YouTube, LinkedIn, and Instagram under Color Wellness Mag. And we look to be we are the first Black wellness magazine by Black nurses, but we look to be the go-to for all things Black family wellness. So we want to be your trusted source for education when it comes to getting what you need for your family. What's the newest, and greatest information in health and wellness, as well as, being able to connect with Black nurses as wellness coaches as well. So we're excited to bring it to the people. Yeah.
Absolutely. She's over there doing an amazing work, helping nurses all around the world just learn how to use their expertise in different ways. And it's been amazing to watch. So congratulations on all that you guys have going on over there. And I'm excited to have you on. So let's talk a little bit about just weight loss and the journey. We're going to bring our guest up. Now, listen, I remember when I went to Cleveland to visit my grandmother, right? Mm-hmm. In the time when she was passing. And so we were there for 3 months. I don't know why. My grandmother was about this big, but people thought they needed to bring her food every day, all day. Okay. Whole meals. And and she would take a little bit bite, and guess who was eating the rest of them whole meals? Okay. And, every once in a while I drink alcohol, but I really don't drink. I was a Pepsi drinker. So that's how I relieve stress. So I was drinking Pepsi, whole bunch of water, whole bunch of Pepsi. So by the time I got home, my grandmother, before I was passed, I came home, and then she passed once I got home. And so I had to go back. But right before I left, she pointed to my stomach and said, "You ain't come here with all of that." I said, "You know what? Mind your business, lady. You the one got me looking like this."
All that good food. Listen, oh my goodness.
I'm feeling it. Do you hear me? Mm-hmm. And so, but what ended up happening when I got home, my blood pressure was sky high. Mm-hmm. I ended up in the hospital for a little bit, and I started just on my weight loss journey, and I've lost about 45 pounds now. So yes. I know that it's important that we look at it and talk about weight loss. And I wanted to have an expert on, and even, just you, and talk about your journey or your expertise in that. So how do you feel as it relates to, I would even say, the healthcare industry as a whole, how their health is important?
So many good layers here. Well, I'll start off with my journey, as I'm still on the journey. And as long as I remember, I've been on this journey. So I will tell you, it's actually been one of the whys as to why I built the brand Color Wellness, because of the fact I feel like, it's been a journey from day one. As long as I can remember, even as a child, just always carrying extra weight. And my mom used to tease me and say I had to always get the extra large diapers for you. And that was our little inside joke, but it just made me think about how long I've been in the struggle. And so I said, you know what? I want this brand to be a place where people can come and learn so they can not have to struggle like I did. They can avoid misinformation, disinformation, or just even not having access to information. When I was a child, I don't remember just having health and wellness conversations at our table. It was about those meals, and it was about what's the dessert and what's the drink. So I will say, from the person that's on this side of the fence, is like, it's so important to have these conversations, because somebody out there, they're not having them. They're not having these conversations at the dinner table. It's about what, is on the table. So I want to say that first and foremost for people that know me is that, you can also, I'm still on the journey. That's one thing I want to say. I'm never going to give up, but I just hate that it's taken this long to try to conquer something that I feel like if I had been preventative or started as young as a child, having that education, information, environment, then things would be a lot different for me now. So our goal is to make it where that doesn't happen.
I can agree with that.
Yeah. It's so many pieces. And then, you talked about stress. We haven't even tapped on that. So then comes stress as we, move into adulthood. And we know there's some stress hormones, and I can't wait to hear our guests talk about that today. That plays into it. Female goes into it. Then you may or may not move into childbearing. That goes into it. Like, there's so many layers that just comes. And so through all of that, you're still having to maintain or, decrease intake and increase exercise. Like, how do you balance all of that? So I'm excited to see that. So when it comes to healthcare workers, like you mentioned, I think that's their fight. It's like, I have this very stressful job. I'm working 12 hours a day. So now we have people who are working long hours, demands placed on them, and their sleep. You mentioned sleep earlier, may or may not be able to get the type of sleep they need. Sleep is one of the major keys to just the body being in balance. So there's so many pieces to it. And I think it's good for us to take it piece by piece and learn about each layer so that we can slowly, what I call, make the lasagna. So you got to, learn all the pieces so you know how to stack it.
Oh, I like that. Make the lasagna. That's one of my favorite meals. I could do some lasagna, girl.
I might have to change that analogy.
But I understand the process because no, keep it, because the process is a layered process. You gotta, I get it. And I'm excited too, because I think that's why we have our guest on today. And it's time to really transition into talking to her and really talking about the weight loss journey and what that looks like, and some of the the things uphill and downhill, the pitfalls, the goods, the bad, and the ugly, and the whys, because I think that it's something that so many Americans struggle with, the process of dealing with their weight at any level. I have people that are really little. Like, my aunt is extremely small. She's like almost 60, but she is like this, and she's always been like that since I was young, and she doesn't gain weight. Like, she doesn't gain weight at all. She pisses people off when they see her, right? But she wants to gain, she wants to be able to gain weight. Some people want to lose weight, and just having that, dynamic that goes on. So I'm going to go ahead and introduce our guest today. It's interesting how God does things. Sometimes you meet people. We met not on the weight loss journey or for what she does. We met in another aspect of business, but I remember meeting her and being like, I really like her. Like, how you see people and you're like, I don't know, I like her. And so I did not know at that time really what she did, because it was literally a different aspect of business that we connected on. And then as I started learning more about her and researching, and then I asked questions, and then when I was over by her office, one time I walked in there, I was like, hey, so I'm all in her office and asking questions and things. But I think that being able to just watch Dr. Erica love on the people that she serves, I think that was important for me to see, and even see the work and the transition in the work from the people that she served is what really interests me in talking to her today, because I know it's a process, and I know that there is more of, I can lose the weight, but there's also an emotional side to that too, and what that looks like. And I know just by knowing who she is, I know that she taps into all of that versus just saying, we're going to lose some weight. You know what I'm saying? And I think that it's important to just talk to her about that. So let's go ahead and welcome. Hey, Dr. Erica.
Hello. Thank you so much for inviting me.
We're happy to have you. Happy to have you.
I am Erica Francois. I am a nurse practitioner. I focused quite a bit of fields of nursing, but my main focus during nursing was like trauma care, ICU. And then once I became a nurse practitioner, I transitioned into vascular surgery, where I used to first assist in the operating room. And I did that for about 3 years. And then when we moved to Tampa, I got a job at Tampa General Hospital in bariatric surgery. So you probably heard of bariatric surgery before. That's where we do the sleeve gastrectomy, the gastric bypass, and we also did weight management. So I've been there for about 6-7 years, and some of my patients got a little bit upset when I started transitioning into the more so the surgical side and not so much weight management. And they kind of pushed me, hey, you just need to see me on the side because I can't get an appointment in with you. And so that, like, you know, the light came on, like, bing, maybe, hey, okay, we can do something like this. So recently, as of June 2nd, I became the founder and owner of New Vitality Health and Wellness. So I stepped into you all's world, entrepreneurship. Oh my goodness. I'm so excited. And thank you all for being role models, you know, just watching you all, you know, like they say, you never know like who's watching you, but just watching you all on social media platforms and how you all interact. And every time I hear your name out in the community, both you ladies, it's always something positive and something uplifting. And it has been an inspiration to me. So thank you all for being lights in this community as well. Y'all don't even know it, but your names are in a lot of rooms.
Wow. Yes. God, thank you for that.
Yes. So right now, I mentioned I just, you know, started my own health and wellness program and business. And like what I like to always say, you know, this is first come and see me. This is not a race. If you want fast, quick, I can't help you, you know. And so I always say this is a journey. We are about to be on a journey together. We're about to become, you know, whether you like it or not, besties, basically, you know, and I'm be all in your business. So
I know that's right.
Yep. Because I heard you mention, you know, this is it's a mind body experience, you know, when we talk about weight loss and when we talk about wellness. And I want to make these patients healthier first, more so than just experiencing the weight loss, getting the weight off. I want to make you a healthier you and not just a smaller you. So we're going to do this, you know, that's why I say this is going to be a journey. Do blood, and it consists of, you know, getting blood work. I want to see the baseline, and every 3 months throughout the program, we're checking your blood levels to see like where they are. They improved, and more often than not, yes, we've seen improvements in blood pressure. I always try to give them like diagrams of where they're, so they can see the correlation of where their weight is and their blood pressure. And, you know, I take every time you come in for a visit, you know, you get all your vital signs done. And it's just amazing to see how when their weight goes down, the blood pressure just goes down. And it's like a little beautiful little that happens. So, and when, of course, when patients see that, you know, they really feel like, you know, they have done something for themselves, not just losing weight, but I'm telling you, add on years to your life, and just losing 5% of your total body weight, you know, you add on a year to your life. Women, we cut our breast cancer down by 12% just by losing like 5% of your total body weight. So it's very, very, very important. And what else did I hit?
That was good. I was like, wait. I'm like, okay. No, that was good. Thank you.
Awesome.
Yes. And I have my own journey, and I think that's why I hold this very near and dear to me. Health and wellness, especially there was a statistic that came out that 4 out of 5 African American women are considered either overweight or obese. And I know I'm just, I'm one person, but I want to be a part of that to change the numbers as well. So that hit home to me when after giving birth to my last child 8 years ago. And that's when I was like tipping the scales over, and I have a low ceiling. I'm 5'2". So tipping the scales over 200 pounds at that time. And my cholesterol was through the roof. I didn't even know it. But when I went to get a job at Tampa General Hospital, they wouldn't let me start working because my cholesterol was too high until I was under doctor's care. And so that's when the light kind of came on for me to, hey, you got to make some changes and do something about this if you want to, be here longer. So, and that's when the changes started for myself. Yes.
Yeah. I have a quick question, though. You mentioned cholesterol, and I automatically thought about, I'll often hear the other statistic about heart disease being the number one killer of Black women. So do you mind sharing just a few tips since you went through that journey, and you can, speak from your own journey or not? But what can we do to either decrease our risk, or in your case, how'd you lower your cholesterol?
Right. So, we can't change our genes, of course. We get dealt whatever ones, God has given to us. So that plays a factor with both sides of my family have high cholesterol. But however, yes, we can lower these numbers through, of course, I had to start exercising, right? And I also had to, this was very hard for me. My family, I have a big family, and they love to eat. And we will have a function to celebrate anything. Yes, anything. The baby walking, let's go barbecue. So I had to, for a while, I had to separate myself. I couldn't go to all of the functions. I had to be disciplined enough. And, of course, your family is family. They're going to talk about you. That's all right. I love y'all anyway. But they understood at the end, like, oh, wow. That's why I said it was me. I had to I wasn't disciplined enough. I knew myself. If I went and be like, oh, I'm not going to eat, that's not true. So for about 6 weeks, 8 weeks, I didn't go to the family functions because I knew I didn't eat the macaroni and cheese, at that time. So just cutting back from the fried foods, the grease, the oil, cut it back, with the fried foods. Also increasing my fiber intake. So cholesterol loves to bind to fiber in our bloodstream. So increasing your fiber, either with like benefiber or with oats, chia seeds, flax seeds, your green leafy vegetables, that helps with the cholesterol and that's currently, running around in your body. The fiber, it'll attach itself to the fiber. And then we all know what fiber does, release, and then it goes, excreted from the body. So that helps as well. And I increase my fiber. And then of course, getting the exercise in. I started spinning, and I always tell people, find something that you like to do. Rather than trying to force yourself to go to the gym and you don't really like it. So if you don't really like to do something, a lot of times typically we're not going to stick with it. So it's true. My sister took me spinning. There is a Black-owned spin studio in Riverview, Florida, and I went there. Yep. Yes, I was so embarrassed because I was
my friend is one of the spinners.
Oh, okay. Yes. And I couldn't keep up with them at first. And the owner came over to me and she said, I just want you to move your legs. Just move your legs. And after a while, after going like every day for about 2 weeks, then, hey, I was up on the bike. I wanted to be in the front row, I got this. And they got the music going and everything. It's such a cool experience. So, find something that you like to do. You don't really think of it as exercise. I was like, it's time to go party, It's time to go exercise.
I'm back row. You ain't gonna get me in that front row.
But to mention Benefiber, I literally just put some into my water. So, yeah, I love it. It's really good to help keep that cholesterol low. So I do appreciate that tip. Yeah, but I don't know. Speaking of water, do you want to talk about the importance of water intake? I know a lot of people deal with that problem. Sometimes people just don't like water, but it's so important to weight loss as well. And we hear that, but how do you implement increasing it?
Right. So I'm my own example. And I tell my patients when they come in, I'm like, look at you. Oh, you working on that's your second cup today?
I got 2. Well, I'm on 3, my 3rd cup, but I got 2 cups. I had to split it in 2.
Oh, okay. So that is so hard for me. I cannot stand water, right? So my patients, I always tell them we're in this together. So I'm like, if y'all come in and y'all see this bottle and it still has like water in it, y'all let me know, get on me. Like, you need to get with your water. Water is like our ultimate, like, filtration, like helps to filter all the toxins out of our body. It's so important. Helps to filter the kidneys, the liver, and it also acts as like it helps to coat the joints and everything. It helps us to move better as well, like a great lubricant too. So a lot of times, and I don't know how personal I could get on here, Key. Let me know if I'm like going too far in. But even for women as well, when they complain of dryness and stuff, and like hey, y'all better tap into that water. Y'all want to use all this other stuff, tap into your water, get your water up, and that will help. Water is good for every part of the body. Yes, you're right. And I always tell patients, why drink your calories? I'm like, I feel like that's a waste that we drink our calories. We need, you want to eat your calories that, you're intaking. So I always recommend the water. And if you have to add in like and this for me too. So, if you want to add in, like sometimes you want to add in the little flavors or something like that to help you.
Yeah. Squeeze a little lemon in mine.
And then, it's lemon, mint, anything to help get it down. That's always, a good way as well. Yes, ma'am.
So Dr. Erica, what, if I'm interested in working with you, what does that process look like? If I'm, I may be a little bit nervous too, simply for me, because I know that I'm a good starter and stopper as it relates to anything consistently health related until the past 2 years. Okay. I would get these past 2 years, I'm thankful. But before then, you got me for a good 30 days.
So you make your appointment you could do it online, or you can feel free to call the office to the numbers on the website that you have put up. And then you can also find me on multiple social media platforms, on Instagram, Dr. Mrs. Francois. On Facebook as well, I'm on there, Dr. Erica Francois DNP APRN. So you can find me. I get messages in there, but I know how to, I'll direct you to, where to go. And so your first appointment, I do offer a free consultation. You come in and we talk, and 30 minutes, and I do your vital signs. We do your measurements, everything to see like where you are. So I do offer that. And then we discuss, what your needs are, or what, I think would be best for you on this journey as well. And then at that time, you can make a decision of whether or not you want to join. 95% of the time, everybody's like, I'm ready to start today, Yes. So they're usually, I kind of figure that most often, if you've made it into the door, it's like you've already made up your mind that you're ready to start something. So that's why we just go ahead and start. And then, you won't ever hear me. I don't ever talk about diets. I'm like, diets. We don't do diets. We do lifestyle changes.
So important.
I have to get that in my head. I have to keep saying that lifestyle change, lifestyle change, lifestyle change, lifestyle change.
I was going to say, I had a quick question because you mentioned change, because I think beyond the 30 days, it's what we've learned, is I'm a nurse too. You learn about the process of change. Mm-hmm. So I think that part, again, is why some people even hesitant to start. It's like, I can't make it through that process of change. I've tried so many times. At least this is my story. And this is what I'm hearing from Keandra. Like, I'm just, gonna go for it. But I know usually and a lot of people, after a month, we start to wane, that excitement goes down. Now reality sets in that this is a permanent discipline that we have to keep going and be consistent, right? To win at it. So how do we, at least how do you inside of your program, because now you got me interested, I might be calling you. So yeah, I was going to say, how do you walk us through that change so that we can make it to the other side? Because I think that's what we're talking about.
And so I start off very small. It's more so like a step approach. I'm like, and I have different plans where I have some that come in, and I would say most, they like to come in every week, right? For their weight, they want to see, the changes. And then they say for accountability purposes. Yeah. But I also offer where you could come in once a month. So it sounds like y'all would be every week or so. You come in every week, you get weighed and everything. And you always have access to me or anyone in the wellness center too, that you have questions, concerns. I get so many pictures of like, is it okay to eat this? Text messages. Can I get this? So, and that's what we start off of. I have you doing like four things for it to change per month. Okay. And each month we're just going to add on gradually. I have some that they've been around with me since because I was kind of doing it on the side a little bit. So they've been around with me since November, December. And she just said, I just saw her last week. She goes, you know what? You got me doing a lot of stuff and I didn't even realize it because it was the lasagna, right? And we changed up some of the, we could make the alternative lasagna, but just layering on. And then I don't ever want to make it seem like it's so taxing. This should not be like, oh my goodness, or you're being tortured. I don't even really sometimes label food as like good food versus bad food. We just say some are more calorie dense than others. So we can't have that as often, but there are times that we have to feed into, I say sometimes we have to feed our cravings, and just not all the time. And there are different ways. I used to love like ice cream was my jam. And I just with the help of a dietitian, I found another alternative like Halo Top and, those different brands that help me like to kind of like do away with so much ice cream. Yeah. So there's always ways. I always want it to be like fun, or I don't want it to be like a burden, on you when we're making these lifestyle changes. So, there are some that, I have one, she's like, I'm gonna have to have my glass of wine every night. And I was like, okay, we're going to work on that, and we just slowly work through, the process together. Right. And we get it done. And so you mentioned too, you feel like after like 30 days, you're just done. A lot of times I go looking for you. Sometimes I took a screenshot of a conversation I had with one of my patients, and he was like, yeah, I told my sister that you act like a probation officer. You just show up.
You have to probably come check on me. Yes. I'm trying to be better because I'm very set. Like, I don't want to do that. So I'm really trying to be very open, especially with my workout instructor, really just being more open and saying, okay, I'll try it, versus being like, yeah, I ain't doing that. Y'all going on. I'll do the next set. Keep it going. So I'm trying to not be so rigid in my process, because I'm not hurting anybody but myself. You know what I'm saying? And when you realize that, and I think that's what we have to look at. Like, it's not hurting Dr. Erica. You know what I'm saying? It's hurting her to see you not do well. Yes. But at the end of the day, it's me. It's my results. It's my blood pressure. It's my health. Mm-hmm. And I'm turning 45 next year, and I have a goal. Like, I need to look a certain way. I got a picture for 50. Okay. And the way I'm going the opposite way than what this picture is showing me. So I'm like, no, you know what I'm saying? So I'm excited just to continue to grow. I will be in the office. I'm doing my consultation. Trust that I'm coming. And I'm going to be, I'm going to listen. Okay.
You're going to listen. Okay. That's all. That's the first step. Like, just listen and, cooperate. And I think when patients, when they see like when your provider has been through what you're going through, they have a better understanding and they're really more likely to listen to you. I'm like, listen, I'm in the trenches with you. It's daily for me too. It's a daily struggle. The struggle is real, even for myself. So when they see that and know, hey, I'm human, right. So I'm not just going to tell you, a lot of times they get, from their provider, oh, you need to lose some weight. Help me through this, this process. So I've been able to partner with some of the providers in the area too, that I've been working with, that I handle that portion, that health and wellness. And so I happen to make changes to because now their blood pressure is so low and they bottoming out. And I'm like, hey, I had to cut their medicine, their dose in half, when I saw them, because they know I see them more frequently than they would at their regular primary care provider's office. So, and I just send a note to their primary care provider or text message or something to their office to let them know, so we kind of work in collaboration with making you a healthier you. Yes.
I love that. I love that. So let's tell everybody where they can find you again.
So there we go, newvitalitylife.com. And even on there, you can there are little widgets or something that you could tap on to my social media pages too. Dr. Mrs. Francois that's on IG, and then on Facebook, Dr. Erica Francois DNP APRN. So yes, and I'm on LinkedIn as well. So
that's good. Definitely. Yeah. So definitely check her out, guys, if you are looking. Now, let me ask you this. What if they're not local? Because we are in the Tampa Bay area. So if they're in the state of Florida, I'm here to help. Yes. Awesome. And I can point them in the right direction if they're in another state. I'm a part of a couple of groups that from providers all over the United States, so I can definitely help them find someone as well too. Because we got to start making these changes to change the numbers that are out there. Yes.
So you do telehealth as well?
Do telehealth as well. Yes. Mm-hmm.
And what about IV hydration? I'm sorry.
Yes. So we will plan to start that within the next month, that I will be offering IV hydration. If you need it pronto stat, I know where to send you as well. But yes, I definitely want to add that in too. Yes.
Awesome. Thank you.
Awesome. Yes. Listen, this is why we have Michelle here, because I don't know what to ask. I'm sitting up here like IV hydration. Okay, next. What else you say? What? Okay, because I wouldn't even know what to ask.
I want the whole enchilada.
I need to get my order right, Lord.
Well, which one? Let me, because I'm assuming. So let's just ask this super quick. Tell us about your services, because I've heard of this weight loss, new hot trend. We get medication, some IV. We've heard of injections for vitamin B6 for a long time. Mm-hmm. But what is it? What's in the package? Or is it very
Right. I am an advocate for weight loss medications, appetite suppressants. Some that are new, we've all heard about, the semaglutide, which is like Ozempic and Wegovy, and Mounjaro, the tirzepatide. We've all heard them. They've been in the news everywhere. However, we've been using these drugs for years. And all it takes is like one celebrity, to say that they're using it. And now it's, now it's like on back order until September for some of these medications. So it's a lot of the medications, and then y'all probably heard like the older medications like the Phentermine or Adipex or something that was on the market, hot topic at one time too. Yeah. And we use a lot of drugs, off-label use for weight loss as too. So when you come in, we do a full history and physical and to see what will work for you, because there are contraindications for some of these medications. So some of these new places that are popping up, I always tell patients, be careful, because if they're not asking you what's your past medical history, run. So, allergies or anything, run. If y'all don't see a blood pressure machine in there, run, get out, just, you want something that's going to make you healthier first. We want to be healthy. And then the weight loss will come. But the new medications that are out, what those are, they're GLP-1s, and that's a hormone in the body that we already have, it's in our body anyway. And what it does, it slows down our digestion. It makes us feel full for a longer period of time. So when we tap on that or give you an extra dose of it, per se, with the medication, it slows down your digestion. So you just feel full all the time. And with that, every drug, we all know this has some adverse effects to it, dealing with, from constipation or diarrhea, nausea, vomiting, indigestion that can come along with it. So you do have to use these medications with caution. And don't look at, your friend, it worked for her. Yeah, but we are all different. So what may have worked for, one person may not work for you. Right. And that's why I offered several different like appetite suppressants. You'll be surprised some of the medications that we use sometimes to help with weight loss that are not really labeled for weight loss too. So yes, I do offer that. I am an advocate because I try to not make you hungry and angry. So
I understand that, because that'll be me. I like groceries. I like to eat. I like groceries. I don't like sweets too much. The groceries. Okay.
Yes.
So, all right. This bit has absolutely been amazing. So I want you guys to visit newvitalitylife.com and connect with Dr. Erica. We're actually going to bring her back during our hot topic segment, because I think we have some things to discuss as it relates to some of the meds and the hot topics that's going around in the world today. But thank you again so much, Dr. Erica.
You're welcome.
Thank you. Appreciate it.
Ooh, I mean, these have been so packed, these episodes that we've had. It has really been, I don't know. I feel like after we're done, I'm gonna have my whole life together. Like, if I don't have my whole life together after these 4 episodes and I don't take action. So out there, y'all need to follow up with me. Put in the comments, am I taking action on some of these things that I'm learning? Because it's crazy. It is crazy.
Yep, we have a lot of work to do, for sure. And that's what makes health and wellness so rich. It's such a rich area, but it's so important. That's why they say, your health is your wealth. It really is true. It's like the richest piece of anything that we do. And then everything is trickles down from there. So important. I'm glad we're getting ourselves together. So I thank you, because I'm excited now.
I know, it's a wrap. It's on. We're gonna be spinning in the back. Okay, we spinning in the back. We going in the office, but we gotta go separately. But we can make our appointments. If you at 2, I'll be at 4, so at least we can see each other.
We ain't going out to eat after we finish. We're gonna go walk in the track or something like that, child. We're gonna go to that spin class that she talked about. We're gonna go in the front row.
Yeah. I'm going to be in the back. You can go in the front. I'm not going to the front. I've been there. They're not going to get me. But anywho, that is hilarious. So we're going to get our stuff together, and we're going to, we got stress management. I mean, it's on. It's on.
Right wheels. Oh,
yes. I'm excited. We're getting our mental, physical, emotional, and natural lives together in these 4 weeks. I know that's right. Woo!
I love it. Well, I thank you for it, because like I said before, I need it as well. So I'm sure if I need it, everybody else who's listening needs it. We all need it. We need a refresher, a reminder, things we don't think about. It starts with the water and the sleep, and it goes all the way to actually taking action, going in to see the physician or the provider, taking what you are given to take, following up, and make sure you hit your goals. And I think for me, the slow process towards the goals is what makes the biggest difference. Yeah.
Absolutely. So let's transition into our hot topic for the day. Now, listen, it's interesting that today was the day that we taped Dr. Erica, because of the information that just came out. I'm gonna pause. I'm gonna let you intro the hot topic, and then usually for hot topic, it's just myself and our guest host. But we're gonna bring Dr. Erica back up for this because I think that it's important to have her, as she's a specialist in this area, to really talk about what's been in the news, girl. What they talking about?
Yes. You know, I don't know which news you listen to out there, but I just happen to follow CNN. And yesterday I was scrolling on Instagram and they had this big article. It says something to the effect, and I'm paraphrasing, but it was something to the effect of, you know, the new weight loss drugs are now causing stomach paralysis or colon disease. And so a lot of people were commenting on this story. And again, as the editor-in-chief at The Color Wellness, we share things that I feel to be pertinent to our overall wellness journey. You know, if you all follow us, Color Wellness Mag on Instagram, you know, I'll share something in regards to physical wellness or spiritual wellness, financial wellness, emotional. So we share all the things, a holistic view. But this one was like, you know, more than anyone I've seen as far as the amount of comments. So I shared it in our stories. And so, yeah, it's so funny that, well, hey, maybe it's not funny, God, I mean, it, you know, that it happened that we're talking about this today because some of the meds that she spoke on, the GLP-1s, are so popular. I don't know if people have followed these drugs. In some places they were on back order, like she mentioned, to September. Some places you cannot get them because they start off as diabetes drugs. Like she mentioned, it's just supplementing what you already have in your body. But now that it's been shown to help with weight loss, people are going everywhere asking their providers to, you know, let them start this treatment. So it's hard to keep in stock. And so they're very popular is what I'm saying. But now at the height of its popularity, we have this study or this that's not a study, excuse me, incidents where certain people have complained and said they wish they would have never taken it. So that's why it's a hot topic, because people are experiencing side effects from this hot drug.
Wow. Let's go ahead and bring Dr. Erica up. Now, listen, I mean, for the hot topic, I was like, oh my goodness, this is perfect. So before we start, I want to start with just what are some of the new popular medications being utilized in weight loss? I want to answer that question first so that we know what we're talking about.
So like Michelle mentioned, they are actually diabetic drugs, but we're using them as for weight loss. And then one is specifically for weight losses, which is your Wegovy and Saxenda, which has been around for a little bit. And Ozempic is the diabetic form of that medication. And then we also have the newer one out called Mounjaro. Those are the new more so the new medications that we are using for weight loss. That's been out, and like what Michelle was mentioning, so that story came out. So with any, like I think I mentioned earlier, with any medication, there's always some type of side effects. I wish I could come out with something there was no side effects whatsoever, you know, and then we could all just be on the beach, you know. But there, with any drug, so remember I mentioned it's slowing down your digestion. So some are now developing what we call gastroparesis, where the stomach, and they probably already had this and didn't realize it. And then once they started taking the drug, it just like enhanced this, what's going on. So the digestion, and what that is the food leaving the stomach and how long that takes. So now it's just sitting there. And a lot of times when the food is just sitting there, it could cause a lot of problems, right? That doesn't sound too good if the food is not moving along your digestion, intestinal tract. So, you know, we could definitely develop the whole nausea, vomiting, and then malnourishment because you're not, your body's not absorbing anything now because the food is just sitting there. And you know, like she said, it could cause some colon issues because the food, when it sits, you know, just as it does out in the open in our bodies, it could rot as well. So that's why we have to be careful to where we are getting these medications from. So if it's some little pop-up, I had a patient tell me that she was like, oh, I could get this medication the same place where I get my nails done. I'm like, wait, what?
And you okay with that, sis?
So, when we got, people that are not educated or well-versed or, in this area, and they're just giving the medication to the patient because all they know about it's going to make them lose weight, but not really dealing with the patient's past medical history or paying attention to the side effects that they're telling you about during your, when your follow-up visits and everything. Yes, this can occur. So if I have a patient come in, I put them on their medication. Also, you want to always ask if there is a history of medullary thyroid cancer in the family as well, or if a patient has had medullary thyroid cancer. We do not. It's a contraindication. You're not supposed to be put on this medication. So you're going to ask their past medical history. If a patient comes in and says, I can't stop vomiting or something like that, okay, let's come off the drug. But there are a lot of places they're so into the money then that they not going to take them off of the medication. Oh, here, just, mask it with another drug. But I want to know the why. Okay, why are you vomiting so much? Or if so, let's try something else. So their stomach, we don't have to worry about this whole paralysis of the stomach happening. So they're going to show some signs.
So do you feel like a lot of the issue could be that people are not doing the work to find out people's past medical history, which can then turn into the issues that they may be having on this drug because the drug activates something else?
Yes.
And the simple fact that people may be so focused on weight loss that they don't stop it. And then now they're continuing to take a med that isn't effective for their body. And now they have other issues.
Right.
That's what it sounds like sometimes.
Yes. So I've stopped a couple of my patients from taking the medication, or we'll go down on the dosage, or, I say, hey, let's try something else to see what's going on. If they're consistently now, a lot of times too, and that this is not talked about, because I've asked some patients that may have gotten the medication somewhere else. Hey, did they go over, what you're not supposed to be eating while you're on this medication? So people continue their same, habits, but and how this, I don't know if we haven't talked about it yet, but people continue their same habits and eating the same thing, the same fried foods, everything, but now they're just not eating it as much because the medication's going to stop you, because it's going to make you feel full.
So let's talk about that. Let's talk about, so for me, y'all know, I'm like, I might stop. So if I stop taking the meds, right, what happens?
So if we have not made any lifestyle changes, during this time while we're on the medication and we're still eating the same way, will you get hungry again? Like when you come off? Yes. You're gonna be hungry. And now you still grabbing, the potato chips because you haven't changed that. Instead of while we were making the change, while we were on the medication, we were supposed to be making the changes that I want something, my body's craving something crunchy. So right. Let me go and get this apple or instead of these, potato chips or something like that. So when you haven't made those changes, you still and develop new habits. Like Michelle said, it takes the 30 days, 21 days for us to develop these habits, and we haven't done it. Yeah, that weight's gonna come right back, and probably like twofold, unfortunately, because now I'm trying to make up for lost time.
So what would you say to people who have read these art? I mean, I think with anything, there's going to be fear articles or fear concepts around it. I don't think I've ever done anything where, from exercise to wine. One day they tell you drink wine every day. Next thing they say you're going to die if you drink wine every day. You know what I'm saying? So what do you say to someone who may be interested in working with you, but have read these articles and have a little bit of hesitation?
So right. So we have to weigh our benefits versus risk, right? And that's in everything that we do. And because of the 6 or 7 people that this may have happened to, that was in the article, and let's think about the millions. I totally believe millions of people have been on it, or in the past, or currently on it. That this has occurred. So. Let's weigh our options here. Is weight loss that important to you as far as like getting your cholesterol down, getting your blood pressure down, getting you off of some of your medications, or getting you off of your sleep apnea machine? Let's weigh that risk. We're gonna have to take a little bit of risk to get to that point. Right. Where we could come off of some of these medications and everything. So, and there's risk, with every medication, anything that we do, it comes risk.
Yes, right. I agree. I definitely agree. So thank you. Well, thank you for your expertise on our hot topic today, Dr. Erica. I'm glad you were here and available, because that was good for today.
Thank you.
That article came out yesterday.
Yes.
So I'm thank you for just being a voice in the industry to be able to talk about it and not being afraid of the topic to talk about it, and to be, to have resolution and have us to consider the different ways and options and ways to think about it as well, so that we can make informed decisions for ourselves. I can't make my health decision based off of Michelle, and she can't make hers based off of me. And I think that that's one thing that we definitely were able to address, and I appreciate that. So thank you again, Dr. Erica. We appreciate you.
Yes, thank you so much. Appreciate you. It's been wonderful.
Oh man. This has been an amazing episode, Michelle.
Now you see why we love it so much. Yeah, this is our jam.
I'm talking about, listen, really, I think people just really need to look at the totality of their lives. And that was one of the things that I did. I looked at everything concerning me, and am I happy? Am I not? Why am I not happy? I'm not happy when I look in the mirror. You know what I'm saying? What do I need to change, and how do I need to change that? And, mentally, physically, emotionally, you know what I'm thinking? And I think what we fail to realize is healthcare engulfs all of those avenues, healthcare overall. So again, thank you for another amazing episode of It's Time with Keandraward, with our special guest host, Michelle Green Rose, with Color of Wellness and Nurses.com.
Yep.
Medianurses.com. She is absolutely amazing. So listen, guys, stay tuned for next week's episode. We'll have another health and wellness practitioner on to talk to us about their level of expertise. Again, if you want to be a guest on the show, visit the website right down here, keandraward.com, and tap on the Be a Guest on the Show. We would love to have you to share who you are, what you do with the world. As we close out, remember, it's time. It's time to grow. It's time to learn. It's time to be, and it's time to have. It's your time. Now is the time for you. Don't ever negate the fact that now is your time. It's time, y'all. Let's go. See you soon.
Bye.